Importance of nursing-sensitive quality indicators. Background. I work at the City Hospital as a member of the Quality Improvement Council. I am here to give you a thorough introduction to nursing-sensitive quality indicators, NSQIs, which the National Database of Nursing Quality Indicators, NDNQI, has recognized as significant. NDNQI. The American Nurses Association devised the NDNQI in 1998 to gather information about nursing quality, which analyzes unit-specific nurse-sensitive information. The results of caregiving at the functional phase are encompassed in annual and monthly records delivered by this federal directory. The NDNQI was a leader in introducing evidence-based clinical guidelines since it was the first repository to gather and employ such information. NSQIs. NSQIs cover the organization, procedure, and patient outcomes of nursing practice. They give an analytical model that may be utilized by nurses, departments, and healthcare facilities to analyze the critical nursing care components. The nursing personnel's supply, knowledge, and expertise are reflected in the framework as a nursing metric. Process, on the contrary, pertains to the nursing crew's professional fulfillment, assessments, and responses. The results of a patient's condition, which may be enhanced with appropriate and effective nursing practice, are referred to as indicators. Quality indicator selected. I chose one of the fundamental indicators, RN education and certification, out of the various available indicators. This measure is significant since it directly impacts the standard of nursing service. Importance of monitoring this quality indicator. Education is a significant factor because it is how all nurses learn their craft. Given the rapid advancement of medical science, nurses must continually keep their skills up to date. Most institutions do employee training, such as running simulations, educating the nurses, and providing a means of tracking this metric. The success of patient outcomes is positively linked with the ratio of nursing professionals with practical training and education levels. Such beneficial results include a decrease in the total morbidity of patients with specific illnesses as well as a decrease in unfavorable care-related consequences. A high degree of education and certification demonstrates why it is essential to track this metric by lowering the fatality rate and improving patient outcomes. Why new nurses should be familiar with this quality indicator. The nurses gain from ongoing nursing certification in terms of career promotion. Patient care indicators communicate any possible safety issues that may be addressed and offer a chance to enhance the provision of care. This indication relates to education since it helps novice and seasoned nurses anticipate and avert these possibly dangerous incidents. With training, nurses can determine what may be prevented or whether an incident has occurred. They can also understand how to behave better in the future to prevent detrimental events. New nurses must know that continuing education and certification are the only ways to keep pace with the latest information, skills, and technological innovations. How the organization collects data on this quality indicator. I interviewed the surgery unit's nurse instructor at my institution. The professor notified me that he gathered information and comments from all courses and frequently held in-service coaching concerning the data gathering for this metric. The information is gathered from questionnaires, often sent to the workers via email. Once the necessity arises, the executive subordinates transmit the poll results to the nurse instructors for review after compiling and analyzing them. The facilitator stated that one of the difficulties they face is that they are presently getting results from a lower population of nurses than they were in the past. How the organization disseminates aggregate data. During the interview, I questioned the instructor about how the information is circulated within the institution, and he responded that it is only communicated with the many educators working on that subject. He said that as an institution, they use the information from the surveys they collect after a single class to assess their in-service tutoring efficacy. The data is also utilized to identify areas that require improvement for subsequent schooling. Role of nurses in supporting accurate reporting and high-quality results. Nearly all facets of hospital performance, such as patient safety, bedside and prescription administration, support with surgery and other major procedures, data gathering, and evaluation, are directly handled by nurses. When requested to complete questionnaires, nursing staff must engage in factual reporting and provide high-quality data. They must also complete these surveys on time. Nurses may also offer feedback vocally if they believe it will be more precise and meaningful. For clinical audits and maintaining reporting on patient care, it is crucial to accurately input data about nursing treatments. Conclusion: nursing procedures should be continually assessed in order to enhance quality. The National Database of Nursing Quality Indicators serves as a tool to gauge the quality of nursing practice. Nursing quality metrics include method, organization, and clinical outcomes. As the cornerstone of all careers, certification is a significant indicator that nurses should be aware of. Multidisciplinary teams and nursing staff should apply technology to enhance patient care. Nursing-sensitive quality indicators give readers an understanding of how an institution gathers and publicizes nursing metrics. Additionally, these metrics encourage and engage new nurses to provide timely, accurate reports of high-quality data.